Hi, I'm Bob Roth, Managing Partner and Co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show. Welcome to Health Futures, and today I'm really excited to have this guest on board with me. It's a good friend, Todd LaPorte. He's the CEO of HonorHealth, and HonorHealth has had an incredible impact in our community, and I'm here today to bring Todd back. He's been on a couple times, and this is the third time, and this is the first time we're actually just doing podcasting. So without further ado, Todd LaPorte, welcome to Health Futures.
It's great to see you. It's always a pleasure. And it just seems right that we should be together over the holidays. It's such a festive time.
It really is. And for me, for our listeners, some that may have not heard you and I together, can you give our listeners just a little bit about your background? I know about your background, and I know you spent a lot of time in Tucson.
Yeah.
But just for a minute or two, just so that, if someone doesn't know Todd LaPorte, I want them to hear a little bit about you.
Well, you know what? I consider myself kind of Arizona born and raised. My dad was in the military. His last stop was at Davis-Monthan down in Tucson in 1973.
Wow.
And that's what brought the family out here. And I was, I was just, 11-year-old kid. And that became the first time in my life at that point that I had ever then lived in a civilian neighborhood. So I was truly a military brat. And then my dad retired from the military in Tucson, worked for the railroad, and we lived in a civilian neighborhood. And I grew up in Tucson, went to the U of A, and ventured to Phoenix in 2001. And I've loved every bit of it. I love Tucson. It's a beautiful place, but Phoenix has a vibrancy that I was attracted to, and it hasn't disappointed me in 25 years.
2001, did you start with Scottsdale Healthcare?
Did. So My career started with Ernst & Young, a CPA firm. I am a CPA, and did that for 8-9 years, served a whole array of clients, especially in healthcare, but not just healthcare. In fact, one of my premier clients was Burr Brown Corporation, which was a semiconductor company that was publicly traded.
Wow.
And then since has sold to Texas Instruments. But Tucson Medical Center, I've served, I think, almost every healthcare system in the state of Arizona over time. It was TMC, Yuma Regional, Mount Graham, Northern Arizona Healthcare, even Banner when in its genealogy, it was Good Samaritan.
Good Samaritan, yeah.
Yeah. So I've been around.
Wow.
And then what took me up here, of course, was joining what was Scottsdale Healthcare at the time, and has now become HonorHealth.
Yeah. And you started in that role when I met you as the CFO. Is that what you entered in?
Journey was I came to Scottsdale Healthcare as the number 2 finance guy. Then became the CFO in 2007. Then, as part of, in essence, our merger activity with John C. Lincoln in creating HonorHealth, I became the CFO and Chief Strategy Officer, which, by the way, the CEO at the time, Tom Sadberry, said, yeah, let's try this. You're good at both of those things. Let's bring those two functions working very tightly together under one leadership. Basically you want to get, one salary and yet 2 jobs.
Two jobs, right.
And I tease you, Tom, if you're listening out there. And we thought, I'll spend 75% of my time as a CFO, which was my comfort zone, and 25% as the Chief Strategy Officer. Turned out it was exactly the opposite, because I had a strong number 2 in finance, and strategy needed so much work.
Exactly.
And I spent a lot of time as a strategy officer in that combined role. But anyways, and then that led to becoming the CEO almost 10 years ago.
It's interesting. You take 2 entities that are, local, community-based
institutions.
Yeah.
John C. Lincoln, who had been here for a long time.
Right.
And Scottsdale Memorial, as I recall, was here a long time. And bringing them two together had to be a monumental task, especially as a CSO and Chief Strategy Officer.
Yeah, there was a lot of heavy lifting for my role to play in making that, first of all, the merger happen, but then to manage the integration that had to happen after that. And, it's interesting as I think back as to what made us a good fit and complementary was we each had, first of all, there was an underlying mission and culture that we are completely simpatico. But then we brought different strengths to the table. John C. Lincoln at the time was very strong in having developed a primary care network.
Mm-hmm.
And HonorHealth had toyed with it, tried it, wasn't so good at it, and was not at that same place. By contrast, Scottsdale Health had a very robust specialty medical community. And so when we came together, that was one aspect of the combination that really brought both of those together, I think, in a very complementary way. They were on a system, an electronic medical record system called Epic. Scottsdale Healthcare coveted doing the same. And we thought, well, they've got a running start. Our combination, we can learn from what they learned. And sure enough, we, in essence, adopted Epic throughout the entire system.
That's a heavy lift.
Heavy
you go
lift.
to a new EMR. That's
Absolutely.
huge.
So there are just so many places where you'd say we complemented each other. And frankly, then, both boats rose as a result of the combination.
I harken back from the time I met you. So, I had a personal relationship with Tom. Just, he lived in my neighborhood and his wife was our school nurse for our kid.
Oh, yes, Mary's fantastic.
Yeah, she's amazing. And, he told me, you got to meet Todd. And I'll never forget meeting you because it was right about the time the Affordable Care Act happened. And I remember sitting down with you and saying, okay, so how's this going to affect HonorHealth? And you're really good at drawing stuff backwards. So I was sitting across from you and you started drawing boxes and you said to
me... Was it on a napkin?
No, but it was on a clean piece of paper and,
okay.
And you were drawing boxes and you were saying, and the best part of it is that they're going to pay us more to have less patients come in. I'm like, it doesn't make sense. And he goes, no, it really does. And I remember you taking me through that and I was like, wow, this guy really gets it. He really understands it. You were very analytical and the way you presented it. And for me, I still didn't get it, but I think I got it a little bit better clear.
Well, it's one of the things that frankly keeps me engaged with healthcare is that our mission is, as we say, to serve the health and well-being of those we serve, right? And it's real. My own father sometimes will say to me, oh, you guys love it when people get sick, right? Almost like we're preying on the vulnerable.
Right.
And I'm like, Dad, that's not at all how the people I work with think. It's not how I think.
Right.
As you know, it's about how do we help people live healthy lives and be well. Now, we're going to be experts in acute care and bringing everything we can to bear to help healing and recovery for those who are in an acute need. But we'd much rather help you prevent having to get to that acute state.
%.
So the question is, how do we work with a reward system that makes that confusing, feels like misaligned incentives? But we've been navigating our way, and there is more and more an environment that can reward us for thinking that way. But the real story, though, is that we don't really even get adequately reimbursed in the current economic system for patients who get really sick and linger.
Mm.
And so anything we can do, what I call demand management, that we can do to help people come into our system with less acuity, even in this kind of weird, what they call fee-for-service system now, there's still a clock that runs and stops. And if people are still lingering after the clock stops, we're still exhausting resources, but not being paid for it.
Right.
So it really is even in our economic self-interest to try to make it so that, people's acuity can be as moderate as possible.
So it really is, the difference between what I would call medicine 1.0 versus 3.0, right? Medicine 1.0 is sick care. My thought process, just like your dad's, is that, more asses in the beds better off.
Yep.
But, as you're describing, reimbursement and the way you guys function as a business, it is a losing proposition if you've got someone that is ill and you can't get them to discharge and get back to some type of normalcy. And really, the medicine 3.0 is more of preventative.
Yes.
And that is the track that HonorHealth is on.
Absolutely.
And I think it's a great segue because we can talk about a lot of this, but it's a great segue because there's a lot of stuff I want to talk to you about. But, it's a great segue to talk about what you're wearing right here, the Blue Zones.
Yes.
And really, I want you to talk a little bit about it because the couple of times I had you on was to talk about the Blue Zones. And, I had the local team here on about a year before they started, and HonorHealth was front and center. And they were saying the reason why we're here is because HonorHealth was the ones that raised their hand and said, we're in.
Yeah.
We're 100% in. And the whole thought process behind the Blue Zone is preventative and healthy and living your best life.
Absolutely.
So if you could talk about that, it's a great.
And, I guess I would just characterize our Blue Zone vision as to how do we help people live more good years?
Right.
Not just more years, but more good years.
Right.
Span. And so, it's really been both a personal and organizational journey, the connection with Blue Zones. I think I mentioned it in a previous visit. I had a heart attack back in 2014.
It's been that long.
It's been that long.
Wow.
And it was an awakening.
Yeah.
And it led me to becoming better educated about how I could basically take better care of myself. And so I have a whole different attitude and perspective on self-care. And so that led me to be introduced to Blue Zones. And then fortuitously, our organization was thinking about how could we be more involved with things like lifestyle medicine. And Blue Zones was looking for wanting to get a community project going in the West. And it was terrific. It was this marriage that was just ready to happen, that HonorHealth wanted to be an anchor sponsor to a community project. But it's definitely, you could say, HonorHealth's commitment to it and inspiration to it, but it is a community-wide effort. And that's always the struggle for organizations that sponsor things like this, is you just can't do it if you think you're going to do it by yourself. And we got to a point where we felt like there was enough critical mass of stakeholders in the community in Scottsdale that were going to support it at the level that was going to be necessary to truly make impact. And so that's why we even defined it as a Scottsdale project. Honestly, we hope it can extrapolate and touch all of the communities that we're serving. But the time was ripe, or the players were ripe to embrace it. And so we've got many companies that are committing to what we call worksite certifications, just as HonorHealth has, to how to make their work environment more conducive to healthy living. It's crazy things like just, what are you serving in your cafeteria? What are you serving in your kitchen?
Right.
How do you accommodate people to maybe even have walking meetings, and just all these little things that add up? How do you make it attractive for people to use the stairs instead of the elevator? And so we're working on all that stuff.
It's about choices, right, Todd?
Yes.
I mean, it's making good choices. I think I had them on in 22, and it kicked off in 23. Is that when the Blue Zone kicked off?
Even before that, slightly before that.
Yeah. Yeah. So, I mean, we've got...
Well, I'm thinking about the planning time, but when the launch,
we've got about 2 or 3 years under our belt.
I think that's exactly correct.
And where would you say you're at right now? Do you feel like you've accomplished a lot? And
we have. What's clearly happened is the awareness of Blue Zones and what it represents. That awareness has increased dramatically. The number of people, of course, who've even made pledges that there are of their commitment to some of the principles that are in what they call their Power 9 is obviously significantly more than prior to it existing. The number of schools that have committed to a certification process, the employers, we've engaged grocery stores, faith-based organizations, and even engaged with public policy. So, yeah, it's been going really well. It's interesting. We utilize a Gallup survey tool to gauge beyond the typical healthcare quality metrics. So we track, mortality and prenatal statistics and all these quality things, diabetics, et cetera. Yeah, we track all that. But through the Gallup survey, we're also being able to track attitude. And so we're seeing that what's happening in Scottsdale, that those types of attitudinal metrics are faring better than what's happening on a national basis.
That's great. Oh my gosh, that's affirmation that you guys are doing it.
So right. It feels good.
Yeah.
I won't say that this is a snap your fingers and something's all better. It's directionally, it's definitely improving.
So I know you know this. I spent some time on the board for a social service organization called Duet Partners in Health and Aging. And I was given this incredible award just a couple weeks ago.
Congratulations.
And thank you for it's the Reverend Dr. Adosha Carlson Legacy Award. I was the second recipient. Dr. Pauline Boss was the first. And our keynote speaker was Nick Butner.
No kidding.
And it was Dan's brother.
Yes.
And I got to tell you, I mean, he got up and spoke and everyone was leaning in. I mean, literally 20 minutes of questions. But there was this one woman that got up and spoke and talked about how it changed her life. She had cancer and she wanted to live a healthier life. She read the book, The Blue Zone. She watched the Netflix series and she changed her diet. And she said, I mean, there were tears all amongst the 400 people that were there because she just brought everyone to tears saying that Blue Zone saved my life. Saved my life. I changed my diet. I was exercising. I was going down a path that there was no way I was going to still be here.
There was a study that came out of BYU that had evaluated what are the factors that most correlate to quote unquote longer living. And there were some usual suspects. The nutrition is in the top 5. The exercise is there. Interestingly enough, flu vaccine was at a higher ranking than exercise. But number 1 and 2, hands down, separated from the field, was close relationships and social integration. And the difference even between the close relationships and social integration was that it was more than just about, hey, where are you at with your close family and friends? But where are you even at with your general community? How you interact with the grocery store clerk, the hairstylist, the plumber. How do you interact with people in general? And the moral of the story is we are just as human creatures, we are in such need of good fellowship. And the funny thing about it is sometimes we think lazily, I don't have time for all of that or whatever. It's not as much as you might think you're giving, it is filling your cup. It is working on you in a way in which brings you more good years.
It's all about kindness, right? It's all about how you deal with people.
Yeah.
I know we're talking about the Blue Zone, and Todd, maybe you can help me because I don't know all the areas, but the Blue Zone was a research that was done by the Butners.
Yes. He was a National Geographic reporter.
And he found 5 communities.
He searched the world for where there was evidence of people living longer. And what is it about those cultures, civilizations that stand out? And are there some themes? And there certainly were. And that was the whole premise of his book and then ultimately his Netflix series. The Buettner family's fantastic. I'm particularly close with Danny Jr.
Okay.
I interact with him a fair amount because of our Blue Zones project.
Right.
And he's just such a kindred spirit, such a friend. And so I feel closest to the Buettner family. And so Nick and the two uncles and Danny were in our tour to Scottsdale last April.
Wow.
They rode bikes with me and we had a great time. And they're coming back.
I was going to say, are they coming back?
They're coming back this year.
And Todd, here we are. It's the holidays and this podcast will probably get released right before Christmas. And, kindness and relationships are so important.
Yeah.
And, socialization is so important too. And, one of the biggest challenges we have as a community is we have so many older adults that are living amongst us that are solo aging. The number is staggering. I mean, it's about 1/3 of our population is 65 and older. So it's really important for us to be social and be relational and be authentic and real and kind. And how do we do this? How do we figure out how we can get these people out? I mean, the movement is part of it, but we have to do this as a community, as a village.
Professionally, you know this even better than I. And in our Gallup surveying and our evaluation of the health of the community in Scottsdale, believe it or not, the number one health issue was social isolation. And what was interesting about it is, if you sort of pieced out Scottsdale by different socioeconomic demographics, it was the one health condition factor that was afflicting all categories. Didn't matter where you were on the socioeconomic spectrum, it was a factor. So those who perhaps we'd think of as more vulnerable, less financial means, feeling social isolation, elite individuals who've accumulated wealth over, long careers, whatever, feeling social isolation. So, it's something to engage with. I actually host a walking moai in my neighborhood.
Walking
moai. So one of the principles out of the book was in Japan, they have moais where in essence, it's a neighborhood group that they, over lifetime, they watch over each other,
right?
Take care of each other. Well, I take my neighbors for a walk for 45 minutes every other Saturday morning that I can make it. And we just go and we talk, etc. I have neighbors who've lived in the neighborhood for 20 years. And when we first started, they didn't even know each other's names. And now they know what their stories are.
Oh, I love it.
And they can talk about what's going on in their lives. And it's silly. It's exercise, but it is that social connection.
It's that engagement that we really need. Well, I appreciate you sharing this. And I love the investment that HonorHealth has made, both financially as well as the time that you all are putting into this.
Yeah, it has been, this isn't just a casual engagement. We've made a significant investment in building a team that is dedicated to the activities and the tactics. And in essence, it was a 5-year commitment, and there will likely be extended commitment that'll be necessary if we really want to kind of see this through. Ultimately, you want it to be where, right, we've got a self-sustaining culture that sort of does it on its own, but it definitely has needed this kickstart.
So if our viewers or listeners want to connect, how's the best for them to connect?
You know what? Look up Blue Zone Scottsdale.
Scottsdale.
Just Google it. There's a website. You'll love this. This one's too cool. We've introduced in essence, a volunteer app called Volunteer Zone. So nonprofits can submit into this their need for volunteers. Volunteers can access it. Say, these are my skills and interests. Ooh. It's a matchmaking service.
I love it.
It brings people to these opportunities. So it's win-win. The people who are volunteering win. The ones who are receiving the volunteers win. And then what they're volunteering for wins.
Well, it is the win-win. I mean, ultimately, as a volunteer, you want to volunteer for something that you're really passionate about. So it's kind of like a repository
It
where
is.
you can go to.
Exactly what it is.
Thank you for sharing that.
You're welcome.
So there's so many other things that you are doing. And one I want to talk about is the HonorHealth Research Institute. You guys have gotten national recognition. You know, Dr. Michael Gordon, I consider him a friend. He was a doctor for my dad as well as for my stepmom. Can you talk about some of the breakthroughs that are happening to really, it's changing the landscape of healthcare? And as I was talking about before, you know, medicine 1.0 versus 3.0, and there's some great discoveries that are happening.
The Research Institute is becoming less of a secret, but for a long time it kind of was a secret. But we can't keep the genie in the bottle anymore. They have just done such amazing things that everyone has to know about it. I'll give you a sense of scale. It's about an $80 million top-line revenue enterprise inside of HonorHealth, and we're doing hundreds upon hundreds of clinical trials. First in human clinical trials. And there have been breakthroughs as a result of the Research Institute in the area of pancreatic cancer. There would be diagnoses of pancreatic cancer 15 years ago that would have been, in effect, death
diagnosed and adios.
That's it.
Literally.
And people having, fuller extended lives. So very proud of that team. Lots of different realms, in the oncology space, in the cardiovascular space, in the bariatric space, you name it. So its scope has gotten wider and wider over time. I remember when it first was an idea and it was connected with our leader of our oncology service line at the time, Susan Brown. And we literally built a cancer center, but then a research institute to reside next to it on the Shea campus, connected by a bridge. So physically today, if you go, you'll see
the bridge,
the Cancer Center and the Research Institute and the bridge.
Yeah.
And we referred to it as the bridge from care to cure.
Oh, I love that.
And it would be that the standard of care effort would give hope and benefit its patients by having access to these clinical trials at times where maybe they felt like they had exhausted all options. And over here on the cure side, they had access to all these patients that met the criteria, sometimes for very esoteric, narrow things that they were researching. But we had such a volume of patient activity going on over here that the cure could go over and access and get the patients that needed the care.
Love that.
So it's been a wonderful journey. Can you believe it? It is now celebrated. Because I remember it was just an idea, and working with Susan on getting this off the ground, it just celebrated its 20th anniversary.
20 years.
Yeah.
Wow.
Yeah.
That is fabulous. And I know that Dr. Gordon did share, you guys were very much on the front line helping with COVID happen. You guys were doing clinical trials with vaccinations.
Absolutely.
And, it had that kind of national recognition that the federal government saw this as an opportunity.
And what's interesting, there's another era now for the Research Institute, because we have struck a relationship with ASU to be the primary clinical
That's on my
affiliate.
list. Yeah.
It's on the list.
That's on my list to talk to you about.
And
I love that.
And so ASU is known for its innovation and research in lots of different realms, and have declared they're going to engage now with health through ASU Health. We have always had this research infrastructure with an IRB, basically a review board. It's an institutional review board.
Perfect.
To make sure that we're conducting research in the right way. And so we've got ours very healthcare focused. And honestly, where we've gotten the funding for this has mostly come from industry, pharma, medical device industries. They've had, of course, interest that their ideas would come to fruition, and they've needed the research to sort of back up their moving along FDA processes and et cetera. So we've we've largely been funded by industry. ASU has been very successful in tapping into things like the NIH, national federal funding sources. You put us together, drawing from, in essence, different kitties.
Right.
We're all going to be fascinated to see if 1 + 1 = 3.
I think so. I mean, if you wouldn't mind, share with our listeners, because it was on my list. I mean, Dr. Michael Crow he's a brilliant man, and I knew Laddie Kors before him, and I got to tell you what he has done for this university. He's put them on the map, and his vision for the future it's, for lack of a better word, it's visionary. I mean, he sees the future, and the fact that they had a robust nursing school and an innovation and nursing school, they needed a medical school.
Yeah.
And if I understand it correctly, they're in partnership with HonorHealth.
Absolutely.
And I would love for you to talk about this, because what is it going to do as an acute provider here in our community to be training future docs in your facilities, for lack of a better word? The winner is us in the community.
There's just so much potential. And I believe that this is going to not only have a huge impact on our very local community, but on the state of Arizona. And I would like to think, an impact for our entire country. So Dr. Crow is an amazing person. And I've said this, in fact, the Dr. John Schufelt, who has been a very generous supporter of this emerging school of medicine, and has the naming rights now to this school.
You and I ran into him over breakfast about a month ago.
Didn't we?
Yeah,
Isn't that was funny.
And thank you, Dr. Schufelt. I mean, he made a very generous gift. If I remember correctly, it's $100 million.
A terrific person. Yeah. It's more than his generosity, it's his engagement. So he and Dr. Crow and I and Dr. Lisenby, the new dean of the medical school, all provided some commentary about this emerging school. And the thing that sticks out, and even Dr. Schufelt mentioned to me, he said, this is what he remembered about my commentary. It's like, what I said is, ASU gets things done. And so it's more than Dr. Crow and his team being visionaries. It's they get things done.
Love it.
And so that's one of the things that has really attracted HonorHealth to connect with it. But I feel like what we bring to the table for them, aside from even some aspects of financial support to the school, is a laboratory that they get to have a place where these young, bright students can train, but then also where innovative technologies, maybe it's AI tools, maybe it's medical devices, maybe it's new methodologies, can be tested in real life laboratory like what HonorHealth brings. And here's what's unique about HonorHealth. We are a very broad-based healthcare ecosystem. We're not just a hospital system. We have primary care practices. We have behavioral health. We have rehabilitation. We have urgent care settings. We have it in different parts of the valley with different demographics. So what makes us, I think, very unique for ISH, we are going to be able to help them test out and train through a very diverse healthcare ecosystem.
I love it. And for me, it's all about workforce, right?
Yep.
So now we get to develop professionals, doctors and nurses and, medical professionals that are training here and hopefully staying here.
Yes.
Because we need that talent.
Yes.
We're a growing population. I mean, the latest statistic I heard about Scottsdale, between now and 2030, I think we're expecting about another 100,000 people moving here.
Yeah.
So, I mean, HonorHealth has been working really hard to keep up with the population explosion. You guys are opening up new acute facilities, new primary care.
We're doing things in Scottsdale and we're doing things outside of Scottsdale where there is community need. And excited at our Shea campus. We've got expansions of programs.
It's under construction again. I've lived here for 31 years. I've been coming here for 40, and I can remember where the front door was in the front and not the back. And who knows where it's going to be after all of this, but you've had that need and you keep growing on that same plot of land.
In relatively recent times, we put a neurosciences institute on our Osborne campus. Our Thompson Peak campus keeps growing, and we, we always have had plans for it to go beyond the 120 bed facility that it is. It's been zoned to be more than that. And we're at about at that time where that can be happening. At the Shea campus, world-class cardiovascular heart center.
Yes.
Interventional GI center, and even some more parking.
Yeah, that was always a challenge for sure.
Well, we're doing things to address that.
And you talked about the neuroscience, and it's a collaboration. And I would love for you to talk a little bit about the collaboration with Barrow Neurological.
Barrow Spine and Joint, they've been wonderful, a wonderful group serving on our medical staff, and have been, keeping up with us as our footprint has grown. They have, covered it. I know that, for example, when we created the trauma center at Deer Valley, have, kept up with us. So it's a terrific group, world-class doctors. The thing about neurosciences is that I think we are understanding with a more aged mixed population, the issues of neurosciences are, becoming a more prevalent issue, if you will, as it relates to a more aged population that we serve. The thing that's unique about neurosciences is that, particularly neurology, is we're not quite at a place as a society that we necessarily cure the conditions. It's about how to effectively manage them and make it more comforting for those who are afflicted. My own father, he's 90 years old, is myasthenia gravis and dementia. And I know that because of his access to good care and the techniques that he has learned, silly things like doing crossword puzzles and word searches, things that keep his mind sharper. These are the types of even things that we're doing. It's not just in that realm curing, but helping people manage chronic conditions.
I have a client a couple of weeks ago that celebrated 108 years.
Wow.
Is
his name Moses?
No, it's Miriam, Moses' mom. But I will tell you another biblical name, right? Miriam. But the thing I will tell you is that she's 108 years old, solo aging.
Okay.
And only gets really roughly about 30 to 40 hours of care a week. So she's alone a lot. But really the secret is that she does the New York Times crossword puzzle every single day. She does, programs like, Wordle and others that are just, she's a bridge player and unfortunately,
keeps her mind sharp.
Yeah, unfortunately, a lot of her bridge partners are no longer here.
Yeah.
But that's really the secret sauce, right?
Yeah.
Is to use it. If you don't use it, you lose it. But neurology is just one of those things where it's kind of like the brain is like the last frontier to really figure out.
Yeah.
Because it's just so complex and complicated. But as we have an aging population, I would tell you that probably greater than 60 to 70% of issues older people have are really back related, hip related, maybe, dementia related or some type of neurological issue or condition.
Well, and you're touching on, though, something I think that's in HonorHealth's vision is not only do we like to pride ourselves or brand ourselves around this notion of being approachable and trusted experts, but also that we promote, in the interest of being patient-centered, coordination of care. And so you kind of touched on the fact that people come to us, it's typically not just one condition. It is multiple conditions. And so if we can have clinicians who can be very well versed and even just connected in a way in which they're working together all around the whole health of this patient.
Right.
That's where we need to get to.
Son, my dad, in the last couple of years of his life, had 14 specialists that he was seeing, including his primary care.
Yeah. And if they're all working in a disparate, isolated way,
exactly,
that's not good for your father.
No, it's not. And he was taking like 14 pills, at 3 different times a day. And you need that quarterback, and you need that coordination, and you need a system like Epic to be able to have everyone have access.
Well, it's even why we've even rallied around some centers like this Neurosciences Institute, like what we're doing with our Heart Center, is that it even brings specialists inside a general discipline like cardiovascular or neurosciences. It gets them more connected because they're physically in the same building. And so it's amazing how there can be a whole nother level of exchange that goes on just because people are in the same building and maybe even accessing some common resources.
And not be siloed.
Exactly.
Because if they're siloed, then the big loser is the patient.
The patient.
Absolutely. So, you're talking about all these centers.
Yeah.
But we haven't talked about the one that I got a tour of about a month and a half ago, maybe 2 months ago. And it was by the other Todd. And I really want to talk to you about the partnership that you have with CDW and the Transformational Center, which blew my mind. And as you know, you and I talk a lot about where we going in the future, innovation, and HonorHealth is at the forefront. I mean, you're cooking up some really cool things. And I don't know if you want to use this forum to share this. I mean, you talked about the research, institute being like a secret.
I like to think whatever we're doing is community asset. And so, we have an innovation lab at what used to be the campus for John C. Lincoln back in the day.
Right.
And on this campus, there is a room that has some of the most state-of-the-art.
It's not just a room; it's the whole building.
It's a building.
I want our listeners to know.
That's true. I'm thinking of there is there
are rooms in the building.
It's almost like a war room, so to speak. In fact, it has a quality of audiovisual technology that I understand rivals what exists at the White House's war room. And so CDW has been very generous in helping create that so that it can make for a more robust and rich group meeting experience that is its own form of innovation. And then we have literal mock-up medical surgical rooms where, for example, you can walk into a room and with a device on the ceiling, so to speak, it can, in essence, take your vitals.
Ambient monitoring. It's like you don't even know it's there.
You don't even know it's
like
there.
This light here could be it, and it's taking our blood pressure and our heart rate.
And then it's feeding it into an electronic medical record.
It's fascinating to me.
So, and the thing is, there's even a mock-up sort of patient home room to play with. How does this stuff even integrate itself into home use? Care. And what is going to happen in our lifetimes, Bob, knock on wood, we live a little longer.
Thank God. Hopefully.
Is that we'll get the price point to that kind of technology to the point where now for that 108-year-old lady, and you're her son living in New Jersey, and you're worried about how's mom doing, that there could be a level of monitoring that could be occurring that you could know kind of how's mom doing.
And it doesn't have to be like these expensive equipment. No. Todd and I, we were talking about how it could actually be disposable.
Yes.
It could be there, and if it gets left behind, no big deal. It's done everything we needed it to do.
But the technology is advancing to the point where it's driving down the cost to a point where it could be something not just organizations like ours can do for people while they're in a hospital setting, or perhaps something you could do for a parent at home.
So one of the things that Todd Larson was working on,
right,
and it was launching like the next week, and maybe you have insight to this. If you do, great. If not, we can bring you back and talk a little bit more about it. But there were 50 rooms, I think he was talking about, over on the Osborne campus that was going to get this large screen TV in each one of the rooms. And there's a knock center where these nurses would be at. See, the biggest challenge we have... Virtual nursing. And the biggest challenge we have in these acute settings, especially when they're really full, and we talk about workforce and staffing, it's usually when you guys are dealing with respiratory viruses and things that are going on, you only have so many nurses to so many patients, and you want to be able to get to them right away. So he told me that there were 50 that you guys were installing, so that if I was a patient and I pushed the button for a nurse, the nurse would be on the screen in seconds, not minutes, and literally seconds.
Right.
Hey, Mr. LaPorte, what can I do to help you? And if it's something that she or he could solve right there, they could do it. If they needed to elevate it, they could get a nurse right away.
Technology is enabling certain things now to be addressed through that kind of technology. So I will tell you, though, it was interesting. I did a rounding to personally have the experience. And I had a nurse from Oklahoma who was interacting with me in this bed in Arizona. And she had access to my medical record, to, online, whatever vitals were being monitored for me, et cetera. But what was interesting is I said, how often do you do this? Act as a virtual nurse. She said, about 50% of the time. I said, oh. I said, why do you not do it 100% of the time?
Mm-hmm.
She said, because I'm a little scared that I don't want to lose that empathic connection with patients like I get when I am literally bedside. I said, okay, that's interesting. So what we have to be careful of with the adoption of technology is we don't lose that, right? We're all struggling with that in every aspect of our lives. How far do you let digital go? How far does it, at one point, do we miss out on physical touch and, more,
And even in our businesses, so many people are working from home today.
Yes.
And when we talk about leadership and we talk about our teams, we want to give our team members the ability to work from home, but we need them to be together too. And how do you balance that? Right?
And I think the punchline is going to be, it's going to be balance. But I will tell you what, we couldn't or shouldn't stop the technology, because there are cases, and we felt it during COVID, is, would you rather not have a nurse at all? That is a very poor choice.
It is.
So, maybe it's most ideal to have a physical nurse, but if you can't have access to that on a timely basis, that virtual nurse concept is definitely a solution.
And it makes a lot of sense. These nurses work in acute settings like HonorHealth, and they're limited to working, literally 3 days, because it puts them over the 40 hours that they need. Anything over is overtime. And they do have the extended time to be able to be a digital nurse.
Right.
Or, you may be familiar with Navi nurses here. Navi nurses recruits hospital nurses to work in the home setting when they're not working in that setting. It just, I think the resources are there. We just need to figure out how we deploy them.
Yes.
And do it in a way that it's a win for the nurse and certainly win for us as a community and patients that are being served.
Absolutely.
Well, I've got, one question, and, it's never easy talking about, your competitors.
Yeah.
And I always like to look at even home care competitors as my frenemies, because we do compete, but we're friends and we collaborate. And there couldn't have been a better collaboration that happened between you and the other big giant here at Banner than it happened during COVID.
Absolutely.
And that to me was so symbiotic to see as a consumer and someone in the healthcare vertical, to see the two of you guys working together.
Right.
But some, the people that are listening here today or watching, read the local papers and hear in the news or see it on digitally that Banner Health is coming into Scottsdale, or HonorHealth is going into other markets that are Banner.
Right.
Can you talk a little bit about that and the collaboration and how you work?
First of all, I'll frame this as, and I think I speak for all of HonorHealth. We want Banner to be extremely effective and successful at serving the community that they're serving. And so, like I think I mentioned early in the interview, Samaritan was a client of mine. I feel a little bit of a, connection, if you will, to the Banner system and having been a part of their journey. And so I want Banner to be good at what they do, and be able to serve the community well. Yes, we did collaborate well during COVID, I think. We were, as a healthcare community, sharing data, trying to, determine, how could we help each other. There was a major concept of a transfer center where we all sort of did our fair share of the overflow that was coming into the urban environment from the rural environment. And we all stepped up. Our organization has been on record for communicating concern about Banner's foray into wanting another hospital in North Scottsdale. We feel like, two of the highest rated hospitals in the entire state are within 3 miles of where they're contemplating another hospital. Mayo and our Thompson Peak Hospital and our Shea Hospital is right up there as well.
100%.
And so, it's their choice. And we think they're thinking about also they're building an insurance product. They want to have, as much of a network, if you will. But frankly, we service their members we service
their health.
Our network, their network has us as a participating provider. So we're doing that. What we worry about, I know that they've been promoting a concept of free choice and competition. And honestly, I don't even have a problem with that concept, except if it undermines the idea that if we end up oversaturating an area and dilute talent and dilute volume that makes programs highly effective and with experience that's drawn by the people in them to deliver the highest care, it could compromise programs that today are functioning very, very well.
Mm-hmm.
So, we've been on record of at least drawing attention to be careful that we don't oversaturate because of dilution of talent and the effectiveness of programs. And then there's a whole nother set of issues of, what does this do for air traffic, for vehicular traffic, for water needs, et cetera? Those are things that, municipalities have to wrap their arms around.
And for those that live here in Scottsdale, they know the challenges that we're being faced with, the Phoenix Coyotes building an arena and, what's it, Axon and building their community. I mean, there's definitely traffic challenges that are related to that. And seriously, I mean, it is a concern. As a resident here, I will tell you, Todd, getting on the road these days, I thought more people were working from home. It's crazy, the traffic and the congestion. And imagine if more people weren't working from home, how much worse it would be.
Oh, all I will say, again, I think highly of the people that I know at Banner, and I wish them well in serving patients. But I will tell you, I feel that HonorHealth, bringing to the Scottsdale community all of the advanced programs that meet the needs of the community.
Love it.
And we are continuing to invest in more capacity as the community is needing it. And we'll continue to do so.
Final question. So as you look ahead, what are some of the strategic priorities that you're most passionate about for HonorHealth as Maricopa County continues to really grow in age? And as I shared with you, I mean, we're doubling our 65-year-old population. We're going to nearly quadruple our 85-year-old population in the next 24 years.
What I'm personally passionate about is that we've talked about it, don't just treat sick care on the back end, but engage with well care on the front end. I'm most passionate about engaging in an extra special way with those people with chronic conditions that are trying to navigate through what can be a complicated healthcare ecosystem and need that attention. That old saying that right now the 20% are consuming 80% of the resources.
100%.
As a society, if we can figure out a way to get that 20% in a better place, it leaves those 80% of resources in a place where we could create more access to care and impact even more people. I just feel that. So my passion is, let's be good stewards where we engage with that on the front end. We locate in places where there's need and not oversaturate.
Mhm.
And my passion is that we create a system where electronically and even culturally, there's a sense of togetherness and exchange and sharing that comes to bear that makes for that most robust patient experience.
You know, we've talked about a lot here today, and Todd, I can't thank you enough for spending time with us. You've given us a great look at what HonorHealth is building and what you guys are doing here in our community. Everything from research and that institute, innovation, the Blue Zone, the community partnerships, the future really of care delivery. And I love the fact that you've got this transformational center because, you know, the future is bright. But we all know that we're drinking from a fire hose with artificial intelligence. You and I talked about it just as we got here started. So I really feel like you're not only just meeting, as the leader of HonorHealth, the needs of today. I really believe that you guys are leading in the needs for tomorrow. And that's what I love about HonorHealth. And, you know, the one thing I forgot to mention, and I'd be remiss if I didn't bring it up, is the foundation.
Yeah.
And as you know, my family's been part of that foundation. My mother and father for over 40 years, who are no longer here. And me personally, the foundation, you talked about the partnership over at Osborne campus with Barrow. Bob Bouvet was a big factor in that, made a huge donation and is named for that. Talk to us just as we
philanthropy
close.
in our community has been a big part of HonorHealth's ability to execute on its mission. In fact, I've even started to talk to community members in this environment in which the government is pulling back on the support that it's giving for care to be provided in communities. They're kind of saying to states, you're on your own. At the state level, I don't know that they are valuing or emphasizing healthcare as basic infrastructure to a vibrant business community as much as I'd like to see. So I've really kind of said to the community, it's a time in which we can't rely on the government just to do it for us.
Right.
Now, we're the people. The government is the people, but we have to engage at a local level about what we want to see happening at a local level. Our community has stepped up, at least through HonorHealth's lens, very well. And I think we're going to keep working with that. That's why I believe in transparency as to what we're doing and what our vision is, so that they can feel a part of it. People want to know that their generosity is making impact. And so that's the relationship we're building with the community. So it's going well. By the way, I have to get one plug in, right?
Okay.
We are launching along Pima Road a new medical campus, and an integral part of it is going to be our Whole Health Institute. And it is going to be a place where a lot of the lifestyle medicine principles are going to come alive. Things like a teaching kitchen, and yoga and acupuncture and integrative health techniques that are complementary to traditional medicine. We're going to make a place available for that. And through our primary care network, getting doctors trained in lifestyle medicine so that, again, we're treating the whole person, not just writing scripts.
How far away are you from doing that?
It's going to launch in the spring.
Wow. And on Pima.
Right.
Is it near the rehab?
It is.
It's right near the rehab center?
Yep. Right there.
Wow.
So,
You know,
anyways, I had to throw that.
No, I really appreciate that. And I appreciate you talking about the federal government and the state government. You know, as you know, I'm a provider of what is called non-medical care. But, you know, the BBB, and I'm not talking about the Better Business Bureau, I'm talking about the big, beautiful bill,
right,
is going to have a tremendous effect on our community, especially the Medicaid community and the cuts that are happening there. And
by the way, on that, people think, it's a Medicaid community. That's not me. So I'm not going to worry about that. That's someone else's neighborhood. Well, actually, the compromise we put to that and the pressure that puts on the provider system serving everybody is it may compromise programs for every type of payer type. It's not going to be just Medicaid. If there's a program that's going to have a hard time being supported in the future, it's going to impact Medicare patients, commercial patients,
100%.
not just Medicaid patients.
And the other thing that, we struggle with home health is the fact that in the last 14 years, they've only seen an increase in reimbursement of 1.6%.
That's ridiculous.
Where acute providers and post-acute providers are in the double-digit numbers.
Right.
And let's face it, where is care often sought to be and where will it be? It's kind of like hospice. People think hospice is a place. It's a concept. And 99% of the people that are on hospice are at home. So we need to
My father's currently
on hospice?
An in-home hospice.
Okay. And it's a beautiful thing because
Yes.
he wants to be home.
That's right.
And we should give every American and every citizen in our state that ability to be able to age as gracefully and as successfully as one can do in the comfort of their own home. Todd LaPorte, good friend, thank you so much for joining me today. It was a great conversation. I am just so excited on what you guys are about to embark on, and I can't thank you enough. And I look forward to having you back here maybe next year and talking about some of these things.
Thank you for the forum, and thank you for bringing attention to healthcare as a it's a major priority for our community.
100%. Thank you, Todd.
Thanks.
Happy holidays.
You too.
Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.